Yeah. Namaste, everyone. Welcome to today's prenatal session. I'm so excited to have you here. So, thank you for taking time for yourself, your body, and your baby. We are going to dive deeply into something that is truly insightful and empowering for today. Okay, so for those of you, those who have seen for me for the first time, I would like to introduce myself. This is Samprada. I'm a prenatal coach with a strong foundation in anatomy based training. I help expecting mothers reduce back pain, prepare confidently for labor, and feel supported throughout their pregnancy through mindful movement, breath work, and prenatal yoga. And today we have our very special guest. I was waiting for this day, so we could plan it for a week back, and today it is the day for us to have a very renowned, highly qualified birth doula and a child educator. She's none other than Divya. She's a DONA certified Lamaze trained, a hypnobirthing doula, and a yoga educator with advanced training in prenatal and postnatal, hormone, and anatomy based yoga practices. She has supported both hospital and home birth, working closely with doctors, midwives, and labor teams. Her expertise includes labor comfort measures, breath work, partner guidance, and spontaneous pushing, emotional support, and breastfeeding initiation, and creating an informed birth plans. We are honored to have her with us today. So I would like to invite her, spotlighting her. Hi, Divya.
Hi,
Thank you so much for joining us today. We are excited to learn from you and understand the beautiful role of a doula in pregnancy and labor. So I would want to you to please start by sharing your journey. How did you become a doula, and what inspired you to support birthing mothers?
Oh, thank you. Thank you for such a nice introduction, Samprada. It was really nice. Hi, everyone. I'm Divya. Like Samprada said, I'm a doula and a prenatal yoga coach. And yeah, there are a lot of, you know, other things that I do along with it. But yeah, I did have a quite interesting journey, like moving from an engineering field to a something into wellness because my birth itself was very beautiful and I really had a very nice birth. And I all once I had my son in my hand and I decided like I think I need to support women having such a beautiful birth experience. So that is when I decided to move into fitness, like the yoga and prenatal yoga. And I started supporting my own friends, like during COVID, like all of them started getting pregnant. And all of my close friends, in fact, I started teaching prenatal yoga, to them. And that is how I started this journey. And once I moved to Canada, my own clients requested me to be in part of the birth, support team. And that is when I decided to become a doula. And since then, it was no looking back. It's been a beautiful journey for me. I don't know. I think I've done more than 50, 60 birth by now. So it's like a good support. And as a person, also, you learn so much attending every birth because you realize you need to keep your birth experience at the door when you enter to support someone because it's not your birth. It's the mom is writing her own birth story. So that's pretty interesting. Every birth I attend, I know that it's going to be a different story. So but some of this one thing it all stands for is the pillars, or what I call the six pillars. So once the mom is supported with those six pillars, she can write her own beautiful story no matter how it unwinds. We always say she need to have a positive birth experience. Every birth should be a positive birth experience where she looks back and she feel like, yeah, I don't mind having another baby. That is a feel you need to get at the end of the birth. That's what I keep saying. It's not about it has to be vaginal, it has to be, this, some of them say I need to have a water birth, I need to have vaginal birth. And I always say, have a positive birth experience so that when you look back, you should feel I don't mind going through all this thing again. Like I don't mind doing it. It was so beautiful, no matter how it unwinds. So that's how it's been like a marvelous journey, and I'm so happy to share some of the beautiful trips, tips and I would say like something that really you need to be prepared for when you're entering into your labor. So you enter with confidence, you know exactly what you want, So I always tell my mom, like, especially if you're a first time mom, it's a land of unknown going into labor. You don't know what to expect. The second time mom, at least she knows, like, it's with her previous experience that, okay, this is what I know it's going to be like. But for first time parents, it's very different. So I always say that, go prepared, so that anything that's thrown at you in the labor room, you know what to do, what the decision has to be. So it's always nice to go prepared. And there's so many things to be prepared for. I know most of y'all are all constantly on Instagram. I get, like, my own clients, they send me some Instagram reel. They're like, "Oh, Divya, is this also true?" And I'm like, you know what? Then I keep telling, there's so many things that you information that you get, like, and you don't know how much will I remember. So I try to break it into a very simple things, and I tell them, if put it in these categories. Just remember, these are the six categories I'm going to remember, and this is what I'm going to take to my birth, because there's so many things on Instagram, TikToks. I get so many reels from my clients. Let's talk about this. Is this true? Is this true? And I tell them, okay, not everything is true, but yeah, certain things are true, but go with evidence base. So I'm really happy, like, to present some of the evidence based practices which will really build your confidence when you're entering your labor room. We'll cover a lot of topics, so that you know that when you go, you'll be like, yeah, I'm prepared for it. I know I can handle this. So there's so many questions which you might, want to ask. You can always drop it on the chat. And some of them I do actually cover it, because you know, as a person who attends a lot of birth, I know the questions most of the time, the first time parents ask, like, is it scary? Is it painful? Will I have a tear? So everything, we'll try to cover as much as possible, so that you get a clear plan about your labor as well. Okay?
Great. That's a very good start. So, Divya will dive into healthy birth practices now. So, let us all tune in and just understand more about your labor. Okay? Yeah,
We'll start. I'll just share my screen.
sure. Mm.
Yes. Yeah. Hi, like you all know, I'm a birth doula, a childbirth educator, hypnobirthing doula, and a prenatal yoga coach. And each role has helped me gain some insight to support the laboring moms and the laboring family. In fact, like, my support is not only to the mom who's birthing, it's also to the partner who's supporting, because even they feel they're so clueless and they don't know what to do. And as a doula, I also support the partners to know their role, and so that even they feel part of the birth. Because most of the time I hear the dads or the partners saying that, I don't know, my role. I don't feel like, she did all the work and I was just not there. I tell them, your presence is also equally important. Even it's your birth also. It's not only her birth, it's your birth. As a family, you all are giving birth to this child. So as a doula, we try to bring that aspect as well into the picture. So the dads also feel supported. Uh, can we Can I just mute everyone if you don't mind? Like, I think I can hear some sound. Yeah, perfect. Yeah. So as a doula, we also support the partners. So it's very important to have a partner or a support person in your team. So we'll talk about that as well. So we're going to talk about healthy birth practices. So there's so many things that, as a coach, as myself, like, there's so many information that we hold and we don't know, like, if I start talking, like, randomly, like, just about birth, even you guys will feel very overwhelmed. And that is where we feel like, it's not like I can give all the information. There's a ocean of information when it comes to birth. So we try to give, like, something that it's very simple for you all, something that you all can remember, something you can, take it with you, and it's easy. And from there, if you want, you can slowly build on the other information. So we'll try to keep it like the basic pillars, and then eventually we can start building on the other knowledge that you'll want about the birth. Okay. So we generally go with the evidence-based practices that supports safer, healthier, and most positive birth experiences. This simple principle empowers family to make informed decision, trust the natural process of birth. So we try as much as possible. We all want a physiological birth, like any birth that starts naturally without any interventions, correct? And most of the time we also say that to have such a physiological birth, your environment also should support you, your physical health also, because some, yeah, if the pregnancy has been great and doesn't require any interventions, we tell the mom to go for a physiological birth. But yeah, there are situations where the moms are into some medical condition, and that is when some of the medicated birth, or birth with the medical attention is required. Okay, but as much as possible, your environment also should support you, your health should also support you for a good physiological birth. Okay, and most of the time we say it's your mindset. You need to be mentally very strong when you go for a labor. Okay, so the first pillar which we talk about is let the labor begin on its own. Okay, so as much as you're getting closer to the due date, we've always seen moms getting very restless, like because it's almost 39 weeks, and we always say the due date is not the exact due date, it's a tentative due date. You can go beyond 40 weeks as well. I've had moms who have been like for 42 weeks, if they, especially if you have a midwife here, and I'm sure even in Bangalore we have midwives now. So with midwives, they're okay to wait beyond 40 weeks or 42 weeks as well. But most of the hospital birth, yes, we they stick to the 40 weeks deadline. So but as much as I've seen, like most of the birth will end up closer to the due date or just few days past the due date as well. But moms have to be like really mentally strong. It gets definitely it gets difficult when you're getting closer to the due date. Like you'll be like, I'm done, let's just get the baby out, I'm done with it. So but or you should always remember, the labor starts when the baby is completely ready in the womb. The baby sends the signal saying that yes, I'm ready, let start producing the hormones to go into labor. So you should always remember that maybe my baby needs that little extra time, so let's not disturb the environment. Okay, let's wait as much as possible and then let the labor get going naturally. So you need to avoid unnecessary induction. Okay, to support any physiological labor, I always say you need to, like most of them will say, okay, let me get the membrane sweep done, or let's just do the folly balloon inductions, like those kind of things you need to avoid. And I've had moms who have had some of the home remedies like castor oil, like there are castor oils, we always say, like it needs to be taken under the doctor advice or anything. Please don't do it all at home, because we've seen it's definitely a very shitty labor, because you're always in the toilet, because once you have castor oil, it clears your intestine, and there's lots of bowel movement. So if not the home induction, I mean a hospital induction, some of them try doing this home remedies, which is not advisable. The best thing I would always say is going for a date, start eating dates, or start having raspberry leaf tea. Those are the things which will naturally soften up your cervix, because there are evidence for it. So try going something which is evidence based, not something like you know old grandma tales that we call. Yeah, some of the old grandma tales are definitely good, like which for which now the evidence are showing proof for it. But try not doing anything. Like I've seen a lot of things, moms ask me, like people say this can trigger the labor, can I try this at home? And I keep saying don't do it. Like we've seen things go on the other way as well. So try going as waiting as naturally. So patience is key in labor for us. And we always say labor is not a Blinkit or a Zomato order. It can't come in 30 minutes. The labor, you need to give your baby that time to come out. It takes more than 24 hours, sometimes more than 30 hours. And it's okay, it's baby coming out. Imagine the baby has to go through everything. The baby is so cozily sleeping inside, and all of a sudden it's feeling all the contractions. Correct? So I tell moms, like, imagine the baby is all of a sudden going through so many discomforts, and we have to give baby that time. All of a sudden, even before the baby is born, we have so much expectation out of it. So no, let's not do that. Let's give the body the time. It's not a blanket delivery. We have to give more than 24-30 hours for a nice, smooth labor. So most of the mom who are mentally prepared, they are the moms I know that when I support, they're really okay when the labor goes long. They feel like, yeah, it's okay, my baby needs time. Even the baby is doing its job to come down. And most of moms who are not prepared are the one who ends up giving up in the middle of the labor, because they're like, oh my god, it's been 12 hours, oh my god, it's been 15 hours. And they're like, they're mentally given up, and they're like, no, let's not do it, I'm not going to do it. And that is when, like I keep saying, even beforehand, if you know that yes, the labor, the baby takes time to come out, you're mentally prepared. Trust me, the way you look at labor is different even on the day of your labor. They're like so strong. I feel those are the moms who are very strong in the labor room as well. They're like, it's okay, my baby needs time, I'm going to support my baby when it's coming out. So I always say, you work as a team, you, your body, and your baby. So always remember, your focus is only this in the labor. You're focusing one contraction at a time. Think that, okay, even my baby is going through, it's not only me. Okay. Yes. One second, I don't know why it went here. Yeah. Yeah. So the second pillar, the first pillar was the let the labor begin on its own. The second one is actually move and change positions. Okay, so most of the time, if you've heard your friends talk about their labor, even they would have said that, I've just been lying down on my back. Like, I went to the hospital, I was just lying down, and then the doctor said it's been so long, it's been 12 hours, 13 hours, then there's no progress in your cervix. So we need to go for a c-section, or we need to start the pitocin and everything, right? So we always say movement is key. The research has shown the more you move during the day of the labor, the more chances the baby is going to work with the gravity and come down. Okay, imagine you're in labor and the baby has to go, like you're just lying down, the baby has to go against gravity now, because this is your pelvis. The baby has to go against gravity to come out. And but when the movement is key, because when you're in labor, the baby will go with the gravity, it comes down as much as possible. And even a moving and walking around, the pelvic movement, creates more space for the baby to descend as much as possible. So that's a reason we always say movement is key in labor. So we always encourage movements, like even early labor, you're still at home, you're feeling cramps now and then. So that time we always say, go for a walk if you want, and then take a good sleep. Because we want, the more you're calm, the more the contraction will pick up for us. And okay, and the more you're walking and giving some movements, that will engage the baby into the pelvis nicely. And this is where we always say, I've personally experienced where, when I've seen mums without any, who have not done any yoga movements, or who haven't attended any prenatal classes or anything, we've seen a difference in that. Because on the day of the labor, as a doula, when I go, when I say, okay, can we bring your leg this side, can we try this position, they feel like the legs are not meant for it. They're like, how can you bring your leg here, my leg is too tight for me, it's too difficult, I can't sit in this position for a long time. Even the simple coming to a birthing ball on all fours, most of the mom who have not been practicing it have complained, saying that no, no, this is too uncomfortable for me. And but this is one of the beautiful position for us to get the baby down into the pelvis. So that's the reason where, as a doula, even we always say that, try taking some of the prenatal yoga classes, so that your body, if on the day of the labor, is not when you're going to sit and figure out, can I try this position. But in prenatal yoga, without your knowledge, you've done all these positions, and on the day of the labor, your body is naturally able to move in any of those directions. Because trust me, in labor we try a lot, and all the movements that we've shown here, even this, using the cloth and leaning on the cloth and doing the squats in this position, we try even this in the labor room. And I'm talking about the hospitals in India as well. For us, like I have clients where in Bangalore and some of the birth centers, we use all these positions, we use the cloth to go into the squat position, because this opens up your tailbone really well, and it helps the baby get lower into the pelvis. That's one of the reasons why yoga comes into picture, and I highly recommend most of them to start your practice. I know some of the high risk pregnancy we can't support yoga, but I always tell them, after 36 weeks at least, start giving the learning the labor movements at least. Through yoga, learn your labor movements, practice it under the guidance of the teacher. Please don't go with some of the YouTube videos or anything with because you don't know where your alignment is wrong, where how you're moving is right or wrong. So I always say, practice under the guidance of a good teacher. And then so that you, on the day of your labor, it's like a muscle memory. Your body automatically knows how to move. Even in the early labor, I've had clients saying that, what, the movements that you were been teaching in the class, I automatically, my body, the moment it's in discomfort, it knows it how to come to the comfort. So I know, like, okay, I'm going to try these positions, because I understand most of them, what they do is, as a childbirth educator, when a lot of people attend my childbirth classes, of course I share a PDF. I'll tell in the PDF it's given, try this, try this, try this during early labor. But imagine, on the day of the labor, they have to go back to the PDF and check, okay, this is what I'm going to do. But people who have been going to the regular classes, automatically their body knows how to move when the labor kicks in, because there's so many times we would have repeated it. Okay, during early labor you're going to try this, or give this movement, so they know, okay, in the labor I'm going to keep trying all these movements. Okay, so that's one of the reason where we say that labor is a movement is key in labor. If you can get into water, okay, water is therapy for us. As a hypnobirthing doula, most of my hypnobirthing clients are completely unmedicated clients. Or here I've had clients who want to try complete unmedicated birth, and as a doula, if I have to support a complete unmedicated birth, water is my first bet. Okay, I always make sure, if it's a home birth, they rent a pool like this and they keep it. If it's a hospital birth, we go for a take a hospital room which has a tub, because water is key. But now, if you're at home and you're laboring at home, as much as possible, even during the early labor, we always suggest sit in water. Like, just leave the shower, let the shower fall on your back, sit on a stool, okay, and let the shower. Why we call water as therapy is, our body is made up of water, and the moment the water falls, even if you get hurt, the first thing what we do is we dip our hand in the water when we're, in kitchen or anything, right? Like, when we are hurt, we put the hand into the water, and you feel so cooler immediately, like you're like, ah, so it's the same expression the moms give the moment they go into the water. Have had so many moms tell me that, oh my god, like, I was unnecessarily punishing myself by just not doing anything, and all I had to do was get into the water. So even in the labor room, even if your hospital doesn't have a tub, I always suggest, carry a small stool, put a stool, let the shower fall on your body. Because one of the very good reasons, because I've had water births, right? Like, when we attend water birth, the mother delivers inside the water, and there's so many centers in Bangalore that's come, like Astrikas and all, even they support water birth. Most of my clients have delivered even in Bangalore there now. That the reason is, for all the moms who've been telling me that, I'm so scared of the tear, Divya, I don't want to tear. Then I tell them, if you don't want to tear, the first bet you get is the water. Get inside the water, or sit under the shower, because your skin becomes really soft, right? Your skin can stretch when you're in water, because your skin is really soft now. That's the reason, when moms who can't go into the water, we give a warm compression when they're pushing the baby out. We dip the cloth in a warm water, and then we put it against the perineal region. So water is key for you. And the other main reason why we always, if the labor is going really long, we make sure that we get the mom in the shower, is because the moment you're in the water, you really relax your muscles. Because every time you get a contraction, automatically your body is tight, and the muscles are tight now for us. And imagine, your pelvic floor muscles also are getting tight for us. Now, for everything to relax, the first thing what we do is get the mom into the water. Correct. The moment we get the mom into the water, she relaxes her bum, she relaxes her pelvis, her body, everything is relaxed, her muscles are relaxed, and sometimes we see the labor progresses fast when we are in water. Okay, so water is the best bet when you want to go completely unmedicated, or you want to try going unmedicated as much as possible, even if you have any other pain medication in your birth plans. But to push a labor as much as possible unmedicated, then water is your first bet. I would always suggest that. And it's not necessary you need to have a tub, have a small stool, let the shower fall on you. That's enough. Even that is a good one. Okay. The next pillar is the continuous support. So when I ask who is in your birth team, of course, your care providers, your doctors are there in your birth team. Then you would be like, yeah, my husband is in the birth team. Then I would always say that even your family, like your parents, they're in your birth team, because you're communicating with them, saying that, okay, when I go to the hospital, this is what has to be done at home. They're the one who's going to prepare your meal and send it to you in the hospital. So I would always suggest, have a good plan with your birth team. Okay, when I'm in labor, you're doing this, designate the work. the other team, the home team is going to cook meal, and there's some team which you don't want to inform that you're in labor. So put that team also in your birth category. Okay, your support team, this is your support team, and this is the team you don't want to inform. Only after the babies come, I'm going to inform this team that okay, the baby is out. Okay, so have a good plan saying that okay, these are the people who's going to support, and some of them have pet at home, so you have a a support member who's going to take care of your pet when you're not there. So I always say be planned when you're going into labor. If you're a second time mom, you need to be planned. Okay, my baby, someone is going to take care of my baby when I'm in labor. Okay, so you're going to plan ahead of it, because it's not a joke. I have personally experienced where the dad was missing out of the labor because uh, the mom went into labor spontaneously, and they didn't know who's going to take care of the elder child now. And they're running, the dad is, that dad just dropped the mom to the hospital and he is missing, the mom is laboring on her own. And then I go and reach, I'm like, where is the partner? She's like, I don't even know where he is. And when I call, he's like, the friend who was supposed to pick up my daughter didn't turn up, so now I have to find someone else. And you won't believe, the same birth, just before the baby could come, he made that dramatic entrance of pushing the door and entering the laboring room. And the mom was trying to hold the baby inside, poor thing, just to, she like, oh, where is, I want my partner to at least see the birth of my child. And at one point I said, your body is going to push, it's not like you're holding, the body will automatically push now, just let it go. So planning is good. So know who's going to support you in your birth team. Okay, and the support you're going to get in the hospital room, that is your care providers. So care providers and nurses, it depends on who's going to be there on the day of your labor. And because they're always there in that 12-hour shift, they get after 12 hours you get a new doctor, you get a new set of nurses. So that is something which you can't control. The other thing is your partner. So make sure like your partner is there. You can always have a doula in your team. Sometimes it's your friends, you're more comfortable with your friends. I've had mums attending, so some of the mums are like, no, I'm more comfortable with my mother. So but make sure you know who's going to be in your birth team, because they are the one who will be taking the childbirth classes as well with you, or attend some of these sessions, because they need to know what how to support you when you're in labor. That is what I always say, having a good support team is very important, because we have seen people who are supported nicely during the labor, the chances of having a very successful birth is very high, or a vaginal birth is very high. And the evidence has shown that just having a good support system is what the mom needs during labor. Okay, so having your partner, because somewhere you feel okay, this is my safe zone, you're having a contraction, it is painful, it's no joke. But then you just have that hug from your partner or your mom saying that it's okay. Just that support is enough in a labor sometime. See, as a doulas, we're not medical team, right? We don't do anything medical. But what we do is just creating that space for the mom, saying this is your space, it's your safe space. You want to cry, cry, because labor brings everything to the surface. Sometimes we become a sister, I become a mom, I become a friend, I become everything for that birthing person that day. Sometimes I become a support for the husband as well, saying that it's okay, because even for them it gets, everything gets overwhelming. So having a good support system, the mom, she vents out and then she carries all the courage again and she'll finish it. Okay, and why we say having a good support system, because I know in some of the hospital, the other people are not allowed, it's only your husband, or some hospital doesn't even allow that. So those cases are different, because but still they're there in the hospital. And if your husband is allowed in the labor room, your husband should know how to support you. And I always tell the dads, you can do so much more by just holding her hand, saying it's okay. I said, no, you can squeeze her hip, you can comfort her back, you can help her change position. There's so many things that you can try when she's having a contraction. You can remind her of the breathing, because most of the time, most of these sessions today, tell me how many of your partners are attending with you. It's going to be hardly like 2 3 people would have said yes, I'm sure. Because most of the time I see the moms attending these sessions, and I tell the moms, yeah, it's good that you're attending the session, but when the labor kicks in, you're going to forget everything, you're even going to forget how you're going to breathe. So that's the reason I keep saying the partner you attend, because these sessions are for you, because you need to remember how you're going to support your partner, your wife. Or sometimes I've had moms, because in our culture we have the moms going to her, like, the mother will go to her mother's house during the labor, right? For delivery and everything. So I've had the moms attending this session with me. Like I've told the mom, like, auntie, you have to support her like this. You have to make sure she's still breathing really well. And if you think she's not breathing, we'll try to shift to the sounds. Okay, so having a good support system and the support person, your partner or your husband or your sister or your friend who's going to be with you, attend some of these sessions. Okay, because even they need to know how to support you. It's not like, these are things that we don't do every day, that it comes naturally to us, right? Birthing is a natural process, your body will get it out, but how to birth well, you need to learn a little bit of all these things. And these are things that we don't do every other day, right? These are not a daily routine. These are something that we need to practice, and so that it becomes a habit for us. Okay, when she's in discomfort, this is what I'm going to do. On the day of the labor, when the dad is massaging the back, I've had moms scream saying, this is not the way I like it. So I always tell, start practicing your massages and everything even beforehand, so that the moment she's in discomfort, even the dad know, no, this is the massage she likes, I know. So these are small things, but it makes a huge difference in the labor room. So that's one of the thing I would always suggest. Avoid unnecessary interventions. Okay, this is a very big topic generally, but I try to compress it as much as possible, because interventions, it's a altogether, we take it as another class itself. But very small thing, if I have to say how to avoid unnecessary interventions, is uh, you always use brain. Okay, BRAIN, brains. So I always tell my clients, it's not something like, why don't you use your brain? No, it's, yeah, but it can mean something like that as well sometimes, because the reason is, anything comes in the labor room. Okay, they might say that, oh, you know what, your labor is going for a really long time, but I think we need to start pitocin, we need to start artificial oxytocin now. And most of the mom are like, okay, what do I do? Like, should I say yes or no? We always say, the moment you ask what are my choices is when you get a choice. Otherwise, you don't know what choices you had, right? Until unless you ask, like, you go to a store, you don't take the clothes he gives you, right? You don't settle for it. You always say, okay, now tell me what are the choices. Okay, I need a jeans, he'll give you a jeans. He's like, no, give me my choices. He'll give you two jeans, and then you'll be like, no, if I, that is not choice for you. Giving this and this is not a choice. Giving you two clothes and saying, these are the two jeanses that you have, this is the, straight cut, and this is the boot cut, is not a choice. But the choice is what is kept in the shelf, all the jeans. That is your choice, and from those choices, making a decision is your, you need to know that and then make a decision. Correct? So making informed choices to stay in control, then you feel always, okay, my birth went with my choices. It's not saying like, okay, there are times where the mom has to make a decision in the labor room, but when I talk to those mom, they feel like, no, at least I feel I made an informed choice, not something that they said you have to do it and I had to agree. Like, they didn't feel like I was forced to do it. They felt that, okay, I was given all the choices and I took a decision, though. So they feel that, it was an empowered birth, or in, and everything was informed decision, and my consent was taken into it. So brain is nothing but, the first thing you ask is, what is the benefit? Okay, like a small example. The labor is going great, the mother is doing beautiful in the labor room. She's almost 8 centimeters dilated, and now the doctor's coming and they're like, you know what, you've been 8 centimeter for 3 hours, 4 hours now. Why don't we break your water? And so that the baby comes a little more lower into the cervix, and things can progress. Once the water breaks, generally the contraction is pretty higher. So we tell the mom, what are you going to do in such situation? So we tell, you ask, what is the benefit? What's the benefit of breaking my water? And the doctor is going to say, no, the baby is going to come down and it'll push it and cervix will open a little more that time. Then, okay, the doctor gave his, opinion, his or her opinion. Then you ask for, okay, what is the risk? Correct? So benefit, risk. Now ask, what is the risk of me doing this? What is an alternative that I have? Okay, what does your intuition say? And always ask, what in case I say, no, I don't want to do it? What in case if I say that? The moment you start asking all these questions, the moment, that is when you realize you had so many choices to it. Imagine, you say, ask, what is the risk of it? Now once the water breaks, you're always on clock. You have, especially if it's a hospital birth, we know they don't wait more than 24 hours, 30 hours to get the baby out now, because once the water breaks, you're on clock. Alternative, what in case if I don't break the water, the doctor will be like, okay, no, you have chances, you can still try. Like sometimes the baby will break its water naturally, the break the membrane naturally. Go with your intuition. Like if you're feeling, no, I'm coping up really well, I don't want anyone disturbing my body, go with it. And you always say, ask, what in case I say no, not now, or you don't do anything at all. The moment you ask these questions, we always get a lot of choices on the table. Okay, we always say, you ask, only then you get. It doesn't matter what birth it is. Okay, so avoid unnecessary intervention. You avoid unnecessary intervention only when you use your brains. Okay, and always remember, it's your birth story, it's your birth journey, and I always tell, it's not the care provider's journey or anything. So you need to keep the happy ball with you. Don't, not, you're not there in the hospital or anything to make their job easy. No, you're not there to do that. You're there to make your birth, the way you want. Some of the moms have agreed to it, some of them have said no. So it's your decision. Everything should be your, you should feel that, okay, I took the decision, it was not something thrown at me. Okay, that is a, we always say that should be the feeling when you make any decision, saying you asked everything, you asked the benefits, you asked the risk, you asked the alternative, you took all the choices, and you said no. If I say no, because so many times, just by saying the doctors or the care provider saying that no, if I say no, I don't think so, I want to do it, that is the time they give you another choice. Okay, can we do this? Okay, and emergency, you will always know if it's an emergency. That time the doctors or the care providers are not sitting and negotiating with you. Everything is picking up. That's when you know, no, there's something really wrong. Okay, so there is always something to fast track the labor, or something which is actual emergency. There's no kidding when there's actual emergency. We have seen things pick up. They're like, there's no negotiation happening there in the labor room, right? Okay, the next one comes with the follow your body's urge to push. This is so important, because most of the time, like, you've heard your friends or your, family members who have had recent birth saying, I've been pushing for 2 hours, I've been pushing for 3 hours, right? That's because the moment you're 10 centimeter dilated, everyone will be like, okay, you're 10 centimeter, let's push. But we always say, you need to feel that, like how you can't control your poop, right? No matter how much you control, it will come out of your body. That is the sensation you should have, that I can't control, something is coming out. So being 10 centimeter dilated is important, of course. After that, the chances of baby coming down is very nice. But more than that, the baby has to, come down till your vagina as well, right? The cervix is there, then the pathway is there. So we always say, don't try to do that practice pushing for hours together, because after that you're very tired. Instead, try moving around. Even if you're 10 centimeter dilated, you're always free to tell your care provider, saying that, no, give me some time, I don't want to start pushing right now, I want to bear the baby down as much as possible. If you still have that energy, why not? So even with epidural, most of the time, I know most of them must be thinking, what in case we end up taking epidural? How is all these things going to matter to us? Even with epidural, you can still keep changing the position. With epidural, it takes the pain off, it doesn't take the pressure off. You will still have that pressure in your bum, you will still have that pressure saying, oh my God, something is coming out. Okay, so let's bear the baby down. Let the body naturally push the baby out. So some of the moms have told that, we want to go with the natural expulsion reflex. That is how your poop naturally gets come out of your body. The same way the baby will feel that your body will start throwing the baby out of your body, now. Okay, so that is what you have to feel. So for that, lying on the back is not one of the great position, I know. So most of the moms who attend my classes, if I tell them, when every time we come to this topic, which is the worst position to give birth, they all say on the back. And I tell them, the theory is 100, but when it comes to practical, most of the mom will end up giving birth on their back. And I ask them, what happened? Because we, y'all know it's wrong, but why didn't you all, take charge of it? Because when everyone says, oh, baby is coming out, the situation gets very overwhelming. But that is the time you need to make a conscious decision. Yes, baby is coming out, I'm happy, I'm going to beat my baby soon, but no, I'll try all the positions first. I want to try giving birth on my side, giving birth on all fours. Trust me, the moment you say that, you are saying that no, I am not at all comfortable, is when you know you had choice again. Okay, so try avoiding giving birth on your back. It's not a very great position, and a lot of researchers has also said that. But giving birth on other positions is very beautiful, and chances of avoiding tear is much higher when you avoid giving birth on your back, because that is the biggest fear most of the mom have, tear. And most of the time, to avoid a tear, you need to avoid giving birth on your back. Try some other position, try all four, try side lying. You'll be surprised the baby do come out in these positions as well. Okay, so one of the reasons. And always wait for the natural urge to push. You need to feel that urge even after the contraction. It's only not during the contraction. Sometimes they feel the pressure on the bum, but we need to feel it even after the contraction. You feel like, I think I might have to poop. Like, that is a sensation that you get. But during the early or the active stage of labor, you still have that sensation. That is, maybe it's naturally because you've eaten so much, you might naturally go and poop or pass the bowel movement. But this is when the baby is really low into the pelvis. You feel it like, I can't control, things are coming out. Okay, you need to feel that sensation. Only then I would suggest, okay, if you want to feel that something is coming out, if you want to try pushing, try pushing. Okay, if you're completely dilated, there's no cervix around the baby's head, go for it. Yes. Keeping mother and baby together, skin to skin, is beautiful. We always highly recommend, the moment the baby is born, even before cutting the cord, just place the baby on the chest. You can write this on your birth plan. Tell the doctor saying, I want to give my baby that immediate skin to skin. It's like, I always say, it's like that small or the first promise that you kept with your baby. Because I know during the pregnancy we always say, don't worry, amma is always there with you. We always rub it. I've done that with my son also. Like, I used to always say, and I always felt like, imagine this is the first promise you kept. The moment the baby's out, it doesn't know it. All the touch and everything is new to it, because it can understand only you. And the moment you keep the baby on your skin, the kind of oxytocin, that runs the moment, and the baby's body temperature, stabilizes a lot of time. So we put the baby on the mom's skin, because it can understand only her now. Okay, and it initiates a very good breastfeeding. I know some of them, like if you're in your 37 weeks, you might start trying to, collect colostrums, and you might say nothing is coming out. That's totally fine, because once the baby's on your chest, sometime it comes out so beautifully. The most of the moms will start having colostrum once the baby is out, and once the baby's on the chest, because of the rush of the prolactin and the oxytocin that's coming, running into the system now. So we always encourage baby and mom skin to skin. It's so important. Even if it's a scheduled C-section, we ask the dads to give the skin to skin. So one of the parent, please give us skin to skin. And once the mom is moved to the recovery room, we put the baby on the mom's skin. Okay, some of y'all might ask, what in case I don't breastfeed my baby at all, and something is not coming at all. Even if you're bottle feed, even after that, we tell you to take the baby's clothes, give that skin to skin after every feed. Okay, baby just needs that, even post delivery, not only in the labor room, even post that. That's the reason breastfeeding is beautiful, because the baby is constantly touching the mom's skin, right? And that's the reason, even if you're bottle feeding, always make sure after the feed you are giving the skin to skin to your child. That is very, very important bonding, and very good for both your recoveries, in fact. Trust me, even the mom, your postpartum, and for the baby, it's a very good recovery, because the baby has also gone through a lot of things. And this one thing I always wanted to tell you, that imagine, like, you've taken an epidural, you're not feeling the pain, correct? Moms are so comfortable. I've had moms do makeups, and the Dyson comes out, all the hair rolls happen in my labor room. But then I always say, but always remember, the baby is still going through the contraction, you're not feeling it. And when the baby is still feeling it, so keep changing position. Like, changing position, I know I missed out that point there, that when I say you need to change position in labor, even if you take epidural, you can still change a lot of position on the bed. Because again, always remember, your baby is still going through the labor. It's not, you might not feel the pain, but the baby is still going through. So no lying down only on your back, you can still change a lot of positions, even in the even with epidural. Okay. Yes. Like I always say, it's your choice, your body, birth like a diva. Any questions, anyone?
Yeah. So if you have any question, you can just drop in on the chat box. Okay. So one question I have from my side, Divya, the Indian setup, how the hospitals and all will be. And most of the time, maybe the mother hesitant to ask questions or maybe that is not a right support she might be getting in her hospital. So how do you think they can just do their birth planning with their doctors?
So we always say, even before you go into labor, you ask the choices that the hospital provides you. Like you tell, okay, this is the birth preferences I have, and tell me like where do you stand? Like what are the things you support? Do you give me a room which has a shower in it, or that's the reason I always said on the day of the labor, don't go and give your birth plan. You discuss your birth plan even before your labor itself, because sometimes like I said, I had a mom from Manipal, Udupi, and she got to know even beforehand that she's going to be alone. Even the husband is not allowed inside the labor room. The before the private room what they give, the family was allowed, but inside the labor room only she is supposed to be there. So I know, okay, how am I going to take my childbirth classes, because I have to prepare her for a single war now, like one man army she is going to be now. So it's always nice to go prepared, like knowing what the hospital that you have decided that this is the hospital I want to birth, this is my doctor, but know what kind of support are they giving you, so that you go prepared according to it in case. So those are the situations where, like, that's the reason you ask your hospital beforehand saying this is what I want in my birth. Do you provide all these things to me, or how are you going to provide all these things to me? Don't ask do you provide, you always ask how are you going to provide, so they feel that okay, they are supposed to provide you all these things. Okay, so sometimes a small tweak of the way you ask, you might be shocked that, oh, good, I asked this way, that they gave me a lot of these things, like they're ready to open for all the help I need. So always go prepared, ask question beforehand. And sometimes if you know that okay, this hospital doesn't provide this at all, then what other choices do I have? Like there are tens machine, I always say go with a tens machine. Go, but make sure there is a shower in your laboring room. Most of the laboring room, even in India, we have it, like most of them will have a bathroom, right? And there will be a showering area also. But make sure, like if your partner or no one is allowed, you tell your nurse that no, I want to go, please be with me there, because you can't go to the showering area all alone, because what in case you slip or something. So we always say have someone with you, and the nurses are, you will be assigned one nurse in the labor. So always make sure, like, these are things that you should know, that okay, I will be assigned, this nurse is supposed to work with me, so we'll do it together.
Right. Okay, so it's amazing. So understand how you want to birth. So it's your choice, not the hospital one. So you're the one who has to decide the things. Okay, so we have a question in the chat box, like confused about the water birth. How long will I have to be in the water? Does the birth happen in water itself?
Uh, the birth, I mean, if you want, you can still have birth in the water. That's your choice, but it has to be with the care provider. Like, not all birth hospitals or the birth centers have this provision. So find out beforehand if they have a tub. But otherwise, if not the tub, it's only during that active labor where you're even early labor. Sometimes if the mom is in early discomfort, I always say take a quick warm shower, or just sit in the shower for 10-15 minutes and come back. That moment your body relaxes. Even in active labor, you can still go to the shower. It's not necessary you're birthing in the shower. No, you're just taking few contraction, but the contraction feels much better, because your care providers are always there to check you and tell you that you're still so far apart, the contractions are not back to back, or the contraction is still spaced out. So that is when you still have the choices, that the baby is not too low. Then you go to the shower, sit in the shower for some time, and then come out for 15-20 minutes, then come out. You still feel so good about your body, and you can see things progressing. Okay, and water birth does happen. There are few birth centers. I know at least the one in the Bangalore, where my client had a water birth in the water. They get the baby out, because sitting in the water itself, she kept changing her positions in the bathtub, and it was beautiful. It was really worth going. You need not be scared, because there is always a midwife, there is always a nurse, and there is always a OB also, because just in case, because most of the moms have that fear that what in case something happens, like, because midwives don't do surgeries or emergency C-sections or anything. But you need not worry at all. There's always an OB also within that setting. So in case of an emergency, they come and take you, and it's in the same building. It's not like they have to take you somewhere else and go to another hospital if those are the tension that you have. It's a very beautiful setting. Everything is there. So still it's like the choice that you still have, that I can still have uh, birth that felt that more natural. And even the rooms don't feel like that hospital setting room, like that beeping sound. It's very soothing and calming setup. So if you guys are still early in the labor, I would always highly recommend at least going to such birth centers, because you have both the choices. If you want a hospital birth, you can still go for that in the same building, or if you want a nice birth center kind of a birth, you can still have. Keep your options open at least.
Yeah. And this is
uh,
one question where during water birth, will the water be hot or cold? Which is most
It's
preferable?
like a lukewarm, like how you're taking a shower, right? We don't want very hot water. And there is a misconception that, if the water breaks, you can't go for a shower. You can still go for a shower, even if the water breaks. You can still sit in the shower. That's totally fine. But those are the detailed things that we talk generally in the classes, where water breaks, what are the things to make note of, like the color of the water and all those things. Otherwise, you're good. Like you're just standing in the shower. If sometimes you go, over here we also get them into the bathtub, that's also totally good. Like home birth and all, that's the thing for us, right? Even if the water breaks, they're still in the tub for us. So you can still, but it has to be a lukewarm, not too hot water, a lukewarm water that makes you feel good.
Right. Yeah. So Kirti has a question. What are false labor, early and active labor indications? Okay.
Yeah. False labor, which we call it as a Braxton's contraction, like you feel the belly getting too tight, right? And especially when you're getting closer to the due date, that frequency becomes more. But even if it's we call it as a false labor, but it's still doing a lot of things in your body. Actually, it's pulling the cervix slightly forward and all those things, but you feel it tight only on the belly, and there is no pattern to it. But when you go into the actual labor or the early labor, you see every 30 minutes there's one small contraction. Let it be 10 seconds or 15 seconds. At least there's a pattern to it. So that's a reason when we say, like, is there a pattern? Every 30 minutes, are you feeling a contraction? And early labor can go days together. So most of the mom, I tell them, don't be disheartened. Like I said, early labor is very long. Sometimes it can be 2 days. You have seen some of them saying, I was 2 centimeter dilated for a week. And that's true. They're in early labor, and that can go days together. But there is slight pattern to it. Early labor or actual labor, there is a pattern. Braxton's once happens in the morning, and then nothing throughout the day, or nothing happens really much. So those are the things. We talk a lot about signs of labor, early labor also. There's a little bit of mucus plug releasing. So those are the things we look into. Then we know, okay, maybe the mom is in early labor, because with every time she's having all these things, there's a mucus plug releasing also from her body. So it's preparing her for the actual labor that's going to come, the active stage now. Okay, active stage, when there's a pattern, like active stage, we call it as when every, from 10 minutes it goes to 9, 8, every 6 minutes she's having one contraction now. And this pattern remains for an hour. That's when we know that there is a pattern to it now. So generally over here, it's every 5 minutes you go to the hospital. But in India, for us, every, 10 minutes we tell them go to the hospital if the hospital is close by. Otherwise, you go a little early as well, depending on the traffic and, how your hospital wants you to come. Some of the hospitals where some of my clients, 10 minutes, they go to the hospital, so that they're not stressed about the traffic or anything as such.
Right. So will the hospital allow delayed cord clamping? Now
Yes, they do allow delayed cord clamping.
they take away the babies from mother for vitamin K injection.
Okay, this is something you can always tell the hospitals. I know, because now we know, I know some of the hospitals in Karnataka, at least we know that they do give you a delayed cord clamping, but you need to talk to your doctor beforehand, saying that if the labor goes really well, if the baby has come out really well, I want to have a delayed cord clamping. Like, so generally we say till the stop pulsating. But at least, most of the hospital policy, they'll tell, I'll give you 1 minute. You can always negotiate. It's like a negotiation, though it's your right to have a delayed cord clamping. It ends up becoming a negotiation. That's it. But yes, you can always ask. That's the reason I say, the moment you ask, you had a choice. If you don't ask, you don't even know that you had that choice. Okay, so always ask and tell them that this is what I want, and they'll try to match it up.
Right. So one last question here. Can we collect colostrum before delivery and store it?
Yes,
And
you can. Like, generally we say after 37 weeks, because after 37 weeks it's called as full term pregnancy. So the baby's all like grown, and it's in a good weight and everything percentile. So we always say after 37 weeks. So that's one of the way to induce natural labor also, right? Apart from, like I said, dates, raspberry leaf tea, and breast massage. That's like the moment you start rubbing your nipples, the colostrum comes, and we tell them that you can collect it and store it. Okay, so that in case immediately post delivery, if you're not able to feed, at least you can give this milk to your baby. So get that colostrum collecting kit. You get it on Amazon. Collect it and keep it in the freezer. Put your name and keep it. Yeah. So anything comes, don't waste. Collect it, please.
yeah. So Soumya has a question. I'm worried of delivering baby by laying down. And what if doctor to allow to change position? Please suggest.
Okay, yeah, this does happen. I'm not saying like, so what we say is, you can always tell the doctor that that's the reason immediately after 10 centimeters, we don't want you to start pushing. That is not when you're supposed to push, because most of the time, even after 10 centimeters, mom is not getting that sensation to push. So we always say labor down as much as possible, so that imagine the baby's head is very low, your perineal muscles are stretched really well. And then I know most of the hospitals for us, they tell that you can't, we don't support you, or they're not trained that way, right? So most of the midwives deliver in any position you want, because they have gone through that training. Unfortunately, even the doctors don't deliver in those positions for us, because they're trained to get the baby out in lying down. So in those cases, yes, you have to lie down, but you can always say, give me a good warm compression at my perineal region when I'm pushing. But get the baby down as much as possible with other positions. I would say, you tell, okay, I'm okay to push at the back, but you need to advocate, try sideline pushing. So that's the reason I say, practice your sideline pushing as well, positions like where you lie down sideways, get the leg closer to your chest and practice that, because sometimes the doctors are okay with that. But if not, get the baby down in those positions, and then it has to be on the back. Then that time you can ask for the perineal massage, warm compression. We have seen the tear is much less, because you've already got the baby down with these positions. You lie down on the left side, then after a few pushes you turn to the right, and again give few pushes in those, and then get the labor the baby down, bear the baby down, and then come on the back and get it out.
Right. So that's amazing. So what is that one message would you like to give before we have a drop off? Like we have 20 participants now. So before they leave the group, what is that one message you want to give to all the moms who are getting ready for their birth?
I would always say, go well prepared, like go informed, know your information, collect your information, attend. Like I said, like there's so many things, going prepared it makes so much of a difference, because these are the things that it's not the first time you're hearing in the labor room. So you already know about it, you have done it, and don't randomly go through Instagram. I would say, I always suggest, go through classes, because they know exactly the topics they're covering. Because in Instagram you learn one thing about this, and then you learn a little bit about this, but you don't know in what category are they falling into. But when you attend these classes, they know exactly what happens in the labor room, and that is the information they're giving you, right? And going prepared with your partner as well, like knowing your partner should know how to support you. It makes a huge difference, because uh, you're in a most vulnerable state when you're in labor. Like, you just don't know everything, all the emotions also come into surface, but your husband's just supporting you and shielding you. It makes such a huge difference. So going prepared, like I said, the movements, please attend any of the yoga classes. Like prenatal yogas are like a must recommended if you have a very healthy pregnancy, and if you're in a little bit of a high risk, attend the labor management sessions, like, so that after 36 weeks, 37 weeks, you can learn the movements. Okay, but otherwise it's highly recommended. You'll be surprised when the labor kicks in, you knew exactly where to stand, how to stand. You will surprise yourself. So those are the things you can always do. So I always say, go prepared, take your birth plans, make your birth plans, talk with your care provider beforehand, because on the day of the labor is not something new that you want to try. That's what I always say. Even the breath work, everything beforehand, we practice a lot.
Yeah. Thank you so much, Divya, for guiding us so gently. It's so powerful. I'm sure all the moms here are feeling more aware, prepared, and supported after listening to you. Okay,
Thank you.
before we wind up, I would like to say that if you would like to know much about your labor classes and all, Divya do have special classes where she does labor management sessions and all. So I'll be sharing all the details on our community group. Okay, so if you are listening from an outsider, you can just drop me on the comment section. I'll be giving more information regarding that. So, as we already said that this session, we would like to cover most about your labor tips, and you'll be learning how to birth well through preparations. And this was really an eye-opening session for each one of you, I hope, who are present here. And thank you for being here. And
Thank you.
if I want to say something, you can just say to the group, Divya. Yeah, before we finally
All
wind.
the very best to all the mums, and always remember your body knows how to birth your baby, and you've created this life, you can birth this life as well. So always go with the mindset, if I've created this baby inside me, I can birth as well. Don't let any doubt take over that. You know, you are birthing this, birth like a diva, like I say. Always birth like a diva. Go with that energy. That so you will be doing marvelous job. All the very best to this beautiful journey that you all are starting. Okay?
Thank you so much. So we would like to have you more often in our community and all the sessions.
Definitely.
So I'll be calling out Vidya for this insightful sessions and all. So thank you everyone for being here. Thank you so much.
Thank you. Thank you so much. Thank
Yeah.
you. Bye bye.